Okay, ma'am. Assalamu alaikum to everyone. My name is Saad. Moderating today. So, thank you everyone for joining the session for the preparatory course of CPHQ Cohort 2. Today, we're going to be having our sixth lecture of the series. And our speaker for today is our young, competent, and passionate pharmacist, Dr. Aqsa Hashmi. She's a pharmacist by profession, holding a degree of Master's in Pharmacy Practice. She's also working as Assistant Director in Pharmacy Services and Pharmacovigilance Officer at National Pharmacovigilance Center, DRAP. She has served this platform multiple times before, but it is very kind of her that she had made room for the PhD prep course once again. She'll be talking about the globally important and legal topic of patient safety. So, before leaving the floor for you, Dr. Akshay, there is a general rule for everyone to keep their mics and video cameras shut off during the whole time. And if there is any query or if there is any question, please feel free to leave that question in the chat box or in the WhatsApp group or email, and we'll get back to you as soon as we can. So, thank you very much for tuning in. Dr. Aqsa Hashmi, the floor is yours.
Thank you. I will start. Assalamu alaikum. The topic is patient safety. Although patient safety का topic बहुत vast है और specific इसमें भी medication से भी हो सकता है और बाकी process से भी हो सकता है. लेकिन regarding the CPHQ exam, I have tried to include इतना जितने भी topics sub topics इसमें cover कर सकते हैं regarding the CPHQ in the patient safety management, patient safety movement, and patient safety tools and engagements of certain patient safety tools. We'll start with the basics. As we know that every process, चाहे किसी भी चीज़ का हो, whether you are driving, whether you are operating any kind of machinery, या फिर कुछ भी कर रहे होते हैं, तो there is some inherent risk with that process. And at every step of healthcare provision, there is also an inherent risk. लेकिन ये risk vary करता है with the nature and with the scale. It can be minor, it can be serious, it can be moderate. And the challenge is that the provision of healthcare with the challenge is that the maintaining high level of awareness, because हमें पता है कि अपने patients में, community में, healthcare professionals में हमने मुसलसल एक awareness को maintain करके रखना है कि that community, that healthcare professionals, they're able to detect safety risks and address them and address the risks and all sources of potential risks which can cause harm to the patients. क्योंकि हमारी community में patients और healthcare professionals का बहुत ज़्यादा role है अपनी इसी process में patient safety के. Then the definition of patient safety is that it is a center of healthcare and it is also a framework. लेकिन जो इसके components हैं वो basically culture, processes, procedures, behaviors, technologies, environment को सबको include करते हैं. And the aim of all these is that कि हम सस्टेनेबल रखें, कि हमारे रिस्क हैं वो लोअर लेवल तक ही रहें, हम अकरेंस को जो अवॉइडेबल प्रिवेंटेबल हार्म है उसकी अकरेंस को कम से कम रखें, एरर्स जो हैं वो बहुत कम उसमें परसेंटेजेस तक जितने लोअर लेवल तक आ सकते हैं उतने तक रहें, और हम इम्पैक्ट ऑफ हार्म को जो पेशेंट्स को है वो या तो ना हो या फिर उसका इम्पैक्ट रिड्यूस करें. बट ऑल दिस इट रिक्वायर्स कि जो भी सिस्टम वाइड जो एक्टिविटी है, इट इज़ नॉट अ सोल रिस्पॉन्सिबिलिटी. Therefore, we need to have a coordinated action among the different teams and departments of those healthcare organizations and the community and those working at the national and international levels, whether they are international stakeholders or national stakeholders. So as a baseline measure to increase patient safety, healthcare organizations need to conduct a thorough analysis कि patients जो हैं at the risk of potential medical errors, कौन-कौन से factors हैं और are they willing, और what needs to be done at which level, उनके processes में क्या चीज़ absent है, कौन सी strategies, procedures, policies, और उनके environment में क्या चीज़ किस चीज़ की कमी है. So that after that baseline measure, they can take steps for the patient safety. The global burden of unsafe care, several researches had been done. तो कुछ researches का हम background अगर देख लेते हैं, इसमें सबसे पहले जो एक report publish की गई थी Institute of Medicine इंस्टीट्यूट ऑफ मेडिसिन बाय द यूनाइटेड स्टेट्स में, इसमें द रिपोर्ट वाज टू अर्र इज ह्यूमन बिल्डिंग अ सेफर हेल्थ सिस्टम। इसमें 1999 में जब ये रिपोर्ट पब्लिश हुई थी, जिसके बाद बिकॉज बिफोर दैट द सर्टेन नंबर्स फॉर preventable harm in patients they were not known in statistically। इस रिपोर्ट के बाद जो पेशेंट सेफ्टी में हेल्थ केयर में और जो बाकी इंडस्ट्री के साथ इंसिडेंट्स कह सकते हैं, रिस्क हो सकते हैं। फॉर एग्जांपल हम कह सकते हैं कि जो ट्रैवलिंग में है, जो एयरप्लेन के उसमें है, क्रैशेस में हो सकता है, several other risks। उसके साथ जब ये कंपैरिजन किया गया था, तो इट वाज नोन दैट प्रिवेंटेबल हार्म्स विद मेडिसिन और विद पेशेंट सेफ्टी और हेल्थ के प्रोविजन वो इतने ज़्यादा थे, दे वर अलार्मिंग, which led to several different steps and new health priorities, new researches। काफ़ी सारी ऑर्गेनाइजेशन इन्वॉल्व हुई थी, काफ़ी सारी ऑर्गेनाइजेशन अपने गोल सेट किए थे, एंड ऑनवर्ड्स मतलब डिफरेंट हेल्थ सर्विसेज वर established। Then in 2000, the United Kingdom Department of Health also published a report and an organization with a memory, and several researches were further done। इसमें कुछ है कि हायर जो इनकम कंट्रीज हैं उसमें एस्टिमेट किया गया कि 1 in 10 patients is subject to an adverse event, whereas the same number for lower middle income countries, low and middle income countries, it suggested that 1 in 4 patients was having adverse events। There was another alarming number that 134 million adverse events they occur annually, and this leads to 2.6 million deaths just because of unsafe healthcare। The 60% of deaths in low and middle income countries, these are which can be prevented due to because these occur due to unsafe and poor quality of care, because unsafe care is not just linked to the hospital based care, it is a system wide problem। इस वजह से जो हाफ ऑफ द ग्लोबल डिजीज बर्डन है जो पेशेंट्स फेस कर रहे हैं वो प्राइमरी एम्बुलेटरी केयर में, वो ऐसी चीज़ है कि जो आप प्रिवेंट मतलब इतनी ज़्यादा सीरियस उसमें नहीं होती। स्मॉल प्रॉब्लम्स को जो है बहुत ज़्यादा हम देख सकते हैं कि हाइटेंड उसमें प्रॉब्लम्स में वो शिफ्ट हो जाती हैं, चेंज हो जाती हैं। सो देयरफॉर अनसेफ मेडिकेशन प्रैक्टिसेस और एरर्स हैं, जिस तरह फॉर एग्जांपल इनकरेक्ट डोजेज हो सकती है इन्फ्यूजन की, अनक्लियर इंस्ट्रक्शंस हो सकती हैं, कुछ हम एब्रीविएशंस अपने हॉस्पिटल बेस्ड केयर में देखते हैं वो यूज़ होते हैं जो स्पेसिफिक टू दैट ऑर्गेनाइजेशन हो सकते हैं, लेकिन उनको मिस इंटरप्रेट किया जा सकता है। फिर इसी तरह जो प्रिस्क्रिप्शन पे है या कहीं पे कम्युनिकेशन के दौरान जो राइटिंग है वो इनअप्रोप्रिएट है, इलिजिबल है। उसके बाद इसी तरह की जब मिस इंटरप्रिटेशन होगी तो अवॉइडेबल हार्म जो है वो it occurs but it should be prevented because it can be prevented, because patient safety में यही है कि जहाँ पे जो चीज़ हमारे लिए पॉसिबल है पहले वो तो की जाए। मूविंग ऑन टू द पेशेंट सेफ्टी मूवमेंट्स, बिकॉज जो इंस्टीट्यूट ऑफ मेडिसिन ने अपनी रिपोर्ट पब्लिश की थी उसमें कुछ की रिकमेंडेशंस दी थी, उन रिकमेंडेशंस के बेसिस पे काफ़ी सारे पेशेंट सेफ्टी इनिशिएटिव्स लिए गए थे। The report, the key recommendations were that the leadership, research tools and protocols should be created and established, and it focused on that, ताकि जो knowledge base है safety का, patient safety का, because in any when you're required to take any policy level measures, any actions, आपके पास कोई evidence होनी चाहिए, कोई knowledge base होना चाहिए, कोई data होना चाहिए, तो it required all that कि आपके पास research tools और protocols ऐसे होने चाहिए ताकि ये सारे आपके पास knowledge base develop हो। Next was to the recommendation was to identify and learn from medical errors, because जो आप reporting का अपना system establish करते हैं, any error occurring whether it was preventable not preventable, you had to develop the causal relation after the event had occurred, because this is a reactive approach। So when in a for example in a pharmacovigilance system, whether you are doing the active surveillance or the passive surveillance, or whether it's a voluntary reporting, it develops the database कि वहाँ पे वो medical error अगर identify हो रहा है तो उसको prevent further कैसे करना है, आपने वहाँ पे train करना है, education करनी है, उस gap को fill करना है, किस चीज़ को address करना है। Then raising the standards and expectations कि आपने patient safety अगर improvement लेके आनी है तो oversee करना है कि आपने किन groups को involve करना है और कौन से actions लेने हैं और किसके साथ मिलके लेने हैं। Then implementing the safety practice at delivery levels, कि जहाँ पे आपने पेशेंट को कुछ कोई डिलीवरी कोई हेल्थ केयर प्रोवाइड कर रहे हैं वहाँ पे आप कौन सी सेफ प्रैक्टिसेस को एम्प्लॉय करेंगे, कौन सी इंस्ट्रक्शंस को फॉलो करेंगे, कौन से प्रोसीजर्स को फॉलो करेंगे। इट ऑल्सो रिकमेंडेड recommended that there should be the Center for Quality Improvement and Patient Safety established at the Association of Healthcare Research and Quality. The US government also approved several patient safety organizations after the publication of this report and the recommendations. And different tools, solutions, databases, standards, indicators and checklists जो हैं वो भी मतलब after that develop हुए थे, approve हुए थे. Furthermore, the details regarding these can be referred to in the Healthcare Quality Handbook by Janet Brown. Moving on to patient safety organizations, in response to this movement and the report, जो patient safety organizations काफी सारे develop हुए थे और approve हुए थे, उसमें से कुछ की जो है जिनका impact काफी ज़्यादा था patient safety organizations का, वो यहाँ पे मैंने list किए हुए हैं. I will give you a brief overview of all these and मैंने कुछ links दिए हुए हैं when this presentation is shared or available with you. आप इन links के through further details about these agencies, उनकी working, उनके goals, उनके aims, उनके mission को आप देख सकते हैं, उनके tools जो available हैं आप वो देख सकते हैं. काफ़ी सबने काफ़ी organizations ने अपनी reports कुछ publish की होंगी, आप उन reports को भी go through कर सकते हैं. The Agency for Healthcare Research and Quality, it provides tools and toolkits for all healthcare settings, which are practical and research-based. Its core competencies are data and analytics, health systems research and practice improvement. जो मिशन AHRQ का है वो ये है कि एविडेंस इस तरह की आए कि ताकि आप हेल्थ केयर को सेफ किस तरह बनाएं, क्वालिटी किस तरह उसकी इम्प्रूव करें, हाउ टू मेक इट मोर एक्सेसिबल, इक्विटेबल एंड अफोर्डेबल. It works within the US Department of Health and Human Services with other partners. और ये ताकि अश्योर करे कि जो भी एविडेंस है वो यूज भी की जा रही है एंड इट्स इजीली अंडरस्टूड. It also published a national quality strategy. It was first published in March 2011, जो first NQS था, as the national strategy for quality improvement in healthcare, which is led by the Agency for Healthcare Research and Quality on behalf of the US Department. इसमें ये है कि जो NQS इसके 3 aims हैं. It's better care and healthy people or communities and affordable care. The next institute is ECRI Institute. It is a global independent authority on healthcare technology and safety. It offers real-time guidance to improve patient safety, drive better outcomes through expenditure management, price benchmarking, value analysis of best practice solutions, and along with clinical evidence assessment, patient safety reporting, and customized consultation. जो एक डेटाबेस है, वैल्यूएबल डेटाबेस है पेशेंट सेफ्टी रिसोर्स का, ECRI का, वो है मेडिकल डिवाइस सेफ्टी रिपोर्ट्स. ये डेटाबेस जो है वो ये भी एक्सेसिबल इनकी वेबसाइट पे अगर आप देखते हैं तो इसके बारे में यू कैन गेट फर्दर डिटेल्स रिगार्डिंग दिस. द नेक्स्ट इज इंस्टीट्यूट फॉर हेल्थ केयर इम्प्रूवमेंट. It is a not-for-profit support and consulting organization, and it uses and teaches practical quality improvement methods to enable sustainable changes in health and healthcare. इसने काफ़ी सारे initiatives लिए थे after the report. Some of its key initiatives are IHI Improvement Map. 2005 में campaign launch की थी IHI ने, which is campaign to save 100,000 lives. फिर in 2006 it launched the campaign to prevent 5 million cases of harm. Another initiative is that the companion method along with the voluntary error reporting. This is for accurately identifying adverse events and measuring their rate within the organization over time, within any healthcare organization. Although कि IHI के पास कोई regulatory authority नहीं है and is not an insurance payer, लेकिन फिर भी इसकी campaigns जो थी, जो 100,000 lives की थी या 5 million cases of harm की थी, वो काफ़ी significant change हुआ था उनकी वजह से. Next up is the ISMP, Institute of Safe Medication Practices. It is confidential. It provides confidential consulting services to healthcare systems कि वो evaluate करें अपना medication system और analyze करें medication related sentinel events. Initiatives of ISMP include medication safety alerts, also newsletters for healthcare professionals, and it provides frequent training, educational programs, and teleconferences on current medication use issues. And it also serves as the ambulatory care providers and acute care providers and insurers. The major The organization is the next up is the Joint Commission and the Joint Commission International. These are also the WHO collaborating centers for patient safety solutions as identified by WHO. Uh, First of all, from the Joint Commission of Accreditation of Hospitals was formed in 1951, which later on became the Joint Commission, and it's a standard setting accrediting body in healthcare. जो भी वहाँ पे हेल्थ केयर ऑर्गेनाइजेशंस हैं, हेल्थ केयर सेटिंग्स हैं, जो हेल्थ केयर प्रोवाइडिंग या हेल्थ केयर क्या कह सकते हैं, हॉस्पिटल बेस्ड केयर है या होम नर्सिंग होम केयर है, ये उन सब की एक्रेडिटेशन करती है ऑन द बेसिस ऑफ डिफरेंट नेशनल पेशेंट सेफ्टी गोल्स. It publishes annual national patient safety goals and also updates it और इसमें जो है further details जो है बाद में आगे देखेंगे regarding the joint commission and the national patient safety goals. As a WHO collaborating center, it was granted the status in 2005. Its goal is reducing the high number of serious medical errors occurring daily around the world of the Joint Commission. Next is the National Association for Healthcare Quality. It's involved in development of industry standard healthcare quality, competencies, and certification. And it's dedicated for healthcare quality profession and healthcare quality professionals. It's a primary source for information and for certification and providing different curriculum for healthcare quality professionals. And next is the National Patient Safety Foundation. It partners with patients and families, the healthcare community, and the key stakeholders to advance patient safety and healthcare workforce and disseminates strategies to prevent harm. Then it's the World Health Organization. It's also works for the patient safety. It also has a global patient safety action plan, which was launched in 2021, and it's a 10-year global patient safety action plan. It has also declared 17th September as the World Patient Safety Day. It developed an action plan on patient safety in 2005 and indicating high fives, which was the five standard operating procedures regarding which were specified in specific areas and which was initially followed by 10 countries. Uh, Next up is the National Quality Forum. Sorry. I will continue. Next up is the National Quality Forum. It's a United States-based non-profit membership organization. It promotes patient protections and healthcare quality through measurement and public reporting. One of its activities or charges is that it has to identify a core list of preventable serious adverse events. We'll get to see the list in the coming slides. The main three areas are supported by NQF are public reporting, providing safety practices, and error disclosure. In 2003, NQF endorsed a set of safe practices, which were updated to 34 in 2010, and these should be universally used in clinical areas so that the customers are prevented from harm. Then there is a group of the Leapfrog group. It's an alliance of major companies and other large private and public healthcare purchasers. It was created in part to enhance and add to patient safety activities, but it has neither accreditation or a regulatory authority. Its initiatives are more oriented towards data collection and public reporting. I will tell you about some of the safe practices of Leapfrog. It was established or the alliance came together in 2000, but in 2001, it recommended three safe practices. One of it was computerized physician order entry. The next was ICU-based physician staffing, which is that in the ICUs, specialists should be staffed or should be present so that the adverse events or any incidents occurring there are prevented, because ICU or critical care is very important and should be managed very closely. Another recommendation or another leap was favoring high volume providers, because it recommended evidence-based hospital referrals to patients or anyone who wanted to go for any specific procedure. There are some of the key procedures regarding which the referrals are given. Another leap was added to this set of safe practices in 2004, which was the fourth leap, and it was more regarding scoring or progress on the remaining NQF safe practices. These recommendations were endorsed by the National Quality Forum's set of safe practices. Then there another is the health grid. It's an independent for-profit healthcare ratings company, and the resource for information about physicians and hospitals it can be sought from health grids. Its fifth annual report identified the 238 distinguished hospitals and patient safety. And using the AHRQ patient safety indicators released in the seventh annual report in 2010, it identified the almost 958,000 preventable events. A little bit more detail about the Joint Commission or the Joint Commission International, WHO Collaborating Center for Patient Safety Solutions. The National Patient Safety Goals are established to help the organizations which are accredited to address the specific areas of concern in regards to patient safety, because um, different healthcare settings have a set of specific practices that they offer to their patients or to their customers, and each and every patient safety goal, not all the patient safety goals may be applicable to that specific organization. So that's why the specific areas may be addressed or adopted. The goals are recommended and evidence based and experts recommended, and these patient safety goals are updated annually, and it is discussed whether to remove any specific goal or to add any further or to keep that, depending on the priority safety practice areas. The organizations which are accredited, they also review these goals, and they may recommend to the advisory group whether these goals should be included in the national patient safety goals or not. The accreditation is of course of different types depending on the different facilities. These are the international patient safety goals. The Joint Commission International publishes these goals, and these have been uniform since its publication. These are six in number: identifying the patients correctly, reducing communication errors, safety of high alert medications, safe surgeries and procedures, and reducing healthcare associated infections, and reduce risk of fall. Most of these goals, these cover a lot of other goals or other practices that are the key areas of focus in patient safety. I will discuss a bit about the national patient safety goals, the ones published in 2022. These are in improving accuracy of patient identification. These have been the same. This goal has been the same, and then improving the effectiveness of communication among caregivers. This has also been the same. Improving the safety of using medication. It has been the same and kept the same. Another one added, and it's a bit newer. It's reducing patient harm associated with clinical alarm system. Reducing the risk of healthcare associated infection, it has been kept the same because this area of concern is for most of the healthcare organizations, which is reducing risk of healthcare associated infections, and it has been kept as a goal by almost all of the patient safety organizations. Another one that was added this year, it's preventing healthcare associated pressure ulcers, and the last two are almost the same. The organization identifies safety inherent risks in patient population, and then there are universal protocols for preventing wrong site, wrong procedure, and wrong person surgery. The given reference links here, you can read further details about the reports and the standards regarding these patient safety goals. Another important component is the patient safety culture. It's most basic one, because we know that a behavior component is very important in any case where we need some kind of change or where we need some kind of action from the community, and which needs commitment in the form of behavior change in behaviors and attitudes. The factors for most effective environment are the leader's vision, strategy, managing risk, and encouraging management of errors and intervention. We need commitment from our leaders, our teams, and professionals. When it comes to culture, we need specific procedures and working based on the vision of desired patient safety culture. We need strategies which are designed for improvement in the system and allocation of sufficient resources. Then a culture which encourages the whole community to identify and manage risks, whether these are actual or potential, because it's not a sole responsibility. It's not the job of a single person, not just for the healthcare professional, but patients also need to be a part of that culture. And then a culture which encourages managing risks, because from recognition and intervention to communication of that risk, and therefore minimizing individual blame, because according to researchers it is estimated that approximately 80% of the medical errors are system driven. So therefore it's a system wide approach and a system wide responsibility. The most important patient safety issues faced by the healthcare organizations today are maintaining a culture of safety, identifying organizational champions, deploying sustaining patient safety strategies, determining the key drivers for patient safety programs, and ensuring the adoption of current safety related technologies. Uh, th- because current safety related technologies, these can be whether these are IT based or any other practices or policies or procedures, these might face a bit of resistance or a bit of time, because these are not adopted in just 24 hours. We'll have to bring gradual change and bring gradual commitment to this. The first step in creating a patient safety culture is to assess that the people and the community and the team, the healthcare team is willing to implement the healthcare safety practices that are being brought. Uh, step- and the next step is the key areas of patient safety. We need to have safe structures, environments, equipments, and processes in place. And the effect of staff is also a key area, and the effect of leadership and culture also has a greater effect in patient safety. Structures may involve because we need to design and promote patient safety. It needs the right supplies and the right policies and procedures which address the safety considerations. We need to have a safe environment, whether it's the lighting, temperature, noise levels, surfaces, storages, or other ergonomics, and safe equipment and technologies. It requires examination of the labels, instructions, and features and potential errors that can arise from any medical device. So we need to have a safer medical device and safer medical equipments. The safe processes are also very essential, because when assessment occurs of any patient safety practice, we need to look for factors of complexity, inconsistency, and time constraints. So we need to have those procedures which are concise and which are practical. The effect of people is a lot in patient safety, because it requires attention to many factors. We need to keep in check the employee attitudes, their motivation, their health, their education, their training, and their cognitive functions, because it has an impact on the likelihood of medical errors. The major factor or the major key area of patient safety is the leadership and the culture. It can drive safety issues when there is a willingness to allocate appropriate resources, because we need to also analyze processes, and we need to have the commitment of the leaders and the teams. uh, because when implementing change, it comes from top to bottom. Commitment from the leaders would ultimately lead to the workers, the professionals working at the basic level, to follow those principles. And we need support which is non-punitive error reporting, because when it comes to error reporting, the fear of accountability hinders this process a lot. And we need to promote evidence-based practice, because ultimately when the errors would be reported, when we would have such a system that identifies errors occurring in the medical practice, we would ultimately know which areas we need to focus on. The patient safety incidents, this is mostly related to medication errors or medication safety. These are events or circumstances that could have resulted or did result in unnecessary harm to a patient. The patient safety incident, when it comes to medication use, these are those which reach the patient or which do not reach the patient. Those which do not reach the patient, these are near miss events, and those which reach the patient, these can be harmful incidents or those which do not cause any harm. The harmful incidents can further be either adverse events which are preventable or adverse reactions which are not preventable. And then medication safety is a sub area of patient safety, or a key component of patient safety, because aside from safe procedures, medication safety is also important. It's the freedom from accidental injury due to medical care or medical errors during the medication use process. It's one aspect of the patient safety, and it bridges the safe patient safety with pharmacovigilance activities. These are mostly undertaken or overseen by the patient safety organizations, but not the pharmacovigilance centers. Medication errors, as defined by the United States National Coordinating Council for Medication Error Reporting and Prevention, is any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of the healthcare professional, patient, or consumer. These are just examples, but medication errors can occur during prescribing, transcribing, preparing and dispensing, administering and monitoring. You can also find further, areas or further steps between these during all these processes from prescribing to monitoring. It can also be due to the product packaging or nomenclature, which is look-alike and sound-alike medicines or medication. The medication without harm, it's the third global patient safety challenge. And according to the Global Patient Safety Action Plan, the third challenge, it was the theme of this year was medication without harm, which was the second patient safety day on the 17th September in 2022. It was to address the obstacles in ensuring safety of medication practices, and it aimed to reduce severe avoidable harm by 2050 in the next 5 years. The strategic framework of the Global Patient Safety Challenge, it depicts four key areas, which are healthcare professionals, patients and public, systems and practices of medication and medicines. There are four subdomains of all these four areas, and then each domain, whether it's the patients and public and healthcare professionals, medicines or safe practices, it has further three key areas of action. It's polypharmacy, it's high risk medications and high risk situations, and transition of care. These are all relevant to these four key domains, and these key areas of action, these form the inner circle of this strategy. This is a tool, 5 moments for medication safety. It was used for patient engagement during this year's patient safety day. And it stated the 5 moments which need to be focused on by the patients and or by the healthcare professionals to when they're starting a medication, when they're taking a medication, adding a medication, or reviewing their medication, or stopping any medication. They should check regarding these. They should check with themselves or with their healthcare professionals or with the help of healthcare professionals how they are going to address these queries, so that any error or any unsafe practice can be avoided. The role of patient safety officers and healthcare professionals is very important in patient safety. I will go over a little bit about this set of skills and the responsibilities of a patient safety officer and the healthcare quality professional. The model set of skills by the American Society of Healthcare Risk Assessment, published by the AHRQ and the in the monograph of ASHRM, says that the model set of skills includes global perspective in the patient safety officer, and the set of communication skills, having integrity, data fluency, leadership and change management, and a knowledge base. Whereas the responsibilities of a patient safety officer includes several several key aspects which are mostly related to healthcare quality professional, but these are coordination between leadership and teams, because ultimately the different teams should work in unison, in harmonization with each other, so that efforts are not duplicated, and so that activities are harmonized for patient safety, and the procedures and the policies and the steps being followed are for patient safety and are oriented towards patient safety. And of course, the leadership commitment towards patient safety is also important in this. So the patient safety officer is the coordination link between the teams and between the leadership. The responsibility for liaison for patient safety issues is important because the teams and the committees, when they are working for including patient safety issues in their processes, they are including accurate and timely reporting between the different teams and between the leadership, so that any error which is involving several processes, several departments, several teams should be accurately addressed and accurately proactively taken action against. The coordination between the different teams, it can be the root cause analysis team, or it can be the failure mode effect analysis team, or any other team working there. uh, the development and periodic review of safety policies and procedures would also require this coordination and the role, or the active role of the patient safety officer. Therefore, integration of patient safety activities is very important, along with the teams and along with every procedure or policy that is being followed. The development and review and revision of policies and procedures is also a responsibility, because with time we might need to change, we might need to review our procedures, we might need to keep them updated, keep them at par with the international standards and international goals and other safety goals that are established or that are published and to be followed by the healthcare organizations or settings. The communication of information is very important because when any error or when any unsafe practice is identified, the communication of information, education, and promotion is a key which acts as an update for the teams and for the community and for the healthcare professionals to work in what areas, to improve in which practices. The medical error information management is also important because uh, of course we need to we need to have error reporting systems and processes in place so that these can be prevented in other patients, or these can be taken action against in a very timely and accurate manner to prevent any further or any future harm. The management of adverse events is also in the same way, you can say it's a detailed process, and therefore requires activity of not only the patient safety officer but the whole healthcare organization. It can occur during any process at any step. Therefore, the management is starting from the reporting towards taking intervention and then towards communication. Then there's also risk management. There are risk management plans in place. There are risk assessment, risk minimization, and risk and any actions being taken against the risk. And ultimately, there is the promotion of performance measurement, because performance of a healthcare organization is dependent on the patient safety indicators, the procedures, the policies, the processes that are in place. I will take a pause here. I think I need to have some water. So, any patient safety officer, the responsibility regarding patient safety issues and patient safety activities is mostly related to the patient safety officer. So, establishing facilities with timely and appropriate response and investigation processes for adverse events, for risks, for any safety improvement is very essential. The role of a healthcare quality professional is mostly it's in a broader sense, but it's also related to those that of the patient safety officer. These roles also can, the healthcare quality professional can also be designated as a patient safety officer, but mostly many organizations may have a different patient safety officer and a different healthcare quality professional. The healthcare quality professional is an integral part for improving and for effectiveness of the overall quality strategy of the healthcare organization. And the coordination is important because this link is between the healthcare organization's leadership and the different activities and the different teams. Integration of the patient safety activities and the patient safety procedures between with other functions and with other activities is the responsibility of the quality professional to check that these are in place and these are effectively working, or these need to be improved. It would therefore be a minimization of duplication of efforts in procedures and activities and in other working, because human resource being doing the duplicate efforts is more bizarre than focusing on which key areas need to be improved and which key areas need to be focused on. The education of staff and patients, and the data collection and data aggregation, analysis, and communication is also a key responsibility of a healthcare quality professional. The coordination of events and the performance measurements and prioritizing which practices, prioritizing which indicators, and reviewing all that, and publishing the safety data information on the basis of analysis, and therefore decision making and preparation of any guidelines or any procedures on the basis of all this data. And then ensuring whether any activity needs a reactive approach, or it needs a proactive approach, and coordinating the flow of information between the teams, between the organizations, different areas. Um, Patient safety being taken as a quality measure, it's very important, because we need to measure at which level a healthcare organization is trying to improve for patient safety in various according to various indicators. So the surveys published by the Agency for Healthcare Research and Quality, it helps a lot. It helps the healthcare organizations a lot in checking which uh, areas or which indicators need to be implemented in that healthcare organizations. One of the examples for performance measurement in clinical patient safety areas is given here. These can be the number of sentinel events being reported there or occurring there, or the number of repeated sentinel events that had occurred there, and how much the significant medication errors were reported, how many patients had fall or injury rate, or the number of serious injuries or deaths associated with devices, and any missing medication dose rates, any device associated infection rates, any MRSAs, any pediatric nosocomial respiratory infection rates, and any nosocomial respiratory infection rates. These can be used as an example for the checklists or for the performance measures regarding clinical patient safety. Other areas or other processes can also have a same set or a more broader set of quality measures. And the AHRP survey is freely accessible to all, so you can have a look at it if you want to, and this can be implemented in the healthcare organizations by the quality professionals. This can be adopted according to and tailored according to the healthcare healthcare service being provided there. Next is up is the patient safety tools. These are very important. Patient safety tools are what are required in a healthcare organization when it comes to improving patient safety. These can be a root cause analysis. It's a reactive approach, and FMEA, or the failure mode effects analysis. This is a proactive approach. Then there are surveys, red rules, and safety checklists. The safety culture assessment, it helps identify and measure conditions in healthcare organizations that lead to adverse events and patient harm, and understanding risk factors. So being proactive and taking steps before occurrence of errors is more of a more of an appreciated effort, rather than when an error has occurred and we are reacting to that. So having a set of safety procedures in place, but we need to apply these tools according to the practices that are required, according to what is needed there, because each and every tool has its own benefits and it has its own limitations. The root cause analysis determines the cause of variation in the process. These factors can be human, environmental, equipment, policy, and leadership, or system factors, and we can analyze which was the root cause for the specific error or the specific variation in the process. The National Patient Safety Foundation had developed a definitive guide and code on conducting root cause analysis, which has been endorsed by the Joint Commission and other public and private patient safety organizations. And the FMEA, which is a prospective approach or the proactive approach, it includes review of steps in the process, what could go wrong, that is failure modes, why would the failure happen, that is failure causes, and what would be the consequences of each failure, which is failure effects. The checklists, the surveys or the checklists that provided by the AHRQ, these can be accessed from the given link. And as given as an example for the clinical patient safety, the set of measurements. There are further patient safety indicators for assessing the culture in an organization. And then there are red rules, and these can be called as or for your own understanding, you can call these red signals, because when one of these red rules is broken, anyone in the organization, whether it's a person working at the primary level or a person working at the mid senior level or the top leadership, anyone can um, put us no, alert anyone, because that rule has been broken by by a higher up or by any person. Then there are safety checklists. These checklists are helpful in preparing or implementing, monitoring, evaluating workforce or environment, or on what level is that organization. An example for safety checklists, or an example of a checklist, is the core elements for hospital antimicrobial stewardship program. Checklists are found to improve communication, and it can strengthen adherence with the guidelines, whether these guidelines are published internationally. A core list or a core element of hospital antimicrobial stewardship program can be accessed from the CDC by USA. And there's also an antimicrobial stewardship toolkit and assessment checklist published by the WHO, but that is more for the country level, not for the individual. Maybe also there's one for hospital level as well. It improves the human factors and reduces incidence of adverse events or anomalies in the processes. So checklists are also very helpful and important in as a patient safety tool. Then we have, as indicated earlier, the National Quality Forum. It had an activity, or it had an authority to publish serious reportable events in healthcare. So it published its report, and a report which contained various reportable events in healthcare, and which were included, or which categorized uh, in these areas, which were whether these are surgical or invasive procedure events. These were product or device events, patient protection events, care management events, environmental events, radiological events, and potential criminal events. The Center of Medicare and Medicaid Services announced a proposed rule, because it's an insurance providing company, and it pays the insurance bills or the healthcare bills for their customers, and it updated their payment policies and rates for hospitals under the inpatient prospective payment system. And it included a set of events, because if an event had occurred in these categories, so which were called the serious reportable adverse events or the near events, which was a list of 29 serious reportable events. So they would not pay the healthcare organization the amount that was due on the treatment of the patient, if the patient had faced that serious reportable event after treatment from that healthcare organization. Healthcare safety and technology is an important step in patient safety, because using information technology in provision of healthcare, or in any process in our lives, we are very IT, or and tech is very developing, or very being very updated in each and every process these days. So IT is also has a greater role in provision of healthcare. The benefits are limitless, but there are also some associated errors in provision of healthcare safety in connection with the information technology. Still, there are we cannot reduce or prevent 100% risks, but the IT has the benefit of reducing or mitigating harms to a greater extent. Some of the concerns that are related to this are it needs increasing in standardization, because each and every organization and each and every team or department, it needs to have a standard set of information technology activities for harmonized activity in patient safety or in their processes. An example of the information technology being used by healthcare professionals can you can have an understanding of how we need to standardize when it comes to different processes. Then there is increased needed time for some technology, because setting that technology and getting used to that and employing it in every process might take some time, might say take some training, and might take some getting used to. Then there is also some funding problems, funding concerns, the privacy concerns, some cultural concerns, and then creating it also creates new opportunities for errors, and some errors that we might not be used to, or which cannot be identified that easily. Uh, Various technologies or solutions that are being used. An example is electronic medical records. These are being used worldwide. Electronic medical records by insurance companies or by healthcare organizations, and then computerized prescriber or provider order entry, computerized decision support and barcode medication administration, radio frequency identification systems, smart pumps, IT-based sign-out systems, and communication systems, which are picture archiving and handheld ultrasound. The examples of information technology being used by healthcare professionals in different categories. The examples are given here, which technologies they can use for direct care delivery and for indirect care delivery, and for patient assessment monitoring and surveillance, for remote patient monitoring, and for communication with healthcare team members, for protective devices, for continuous learning, and for pattern identification. So these need to be harmonized or standardized when being used in an organization. For example, for communication, if an organization is using electronic medical records, some other organizations might also have to have those electronic medical records in the same coding or in the same set of programs and in the same formats, so that they can get same harmonized or standard information that they require for their own use. Uh, the last is the outline for the hospital patient safety plan. Each healthcare setting should have a hospital patient safety plan, but this is just an example, and it's a major component of the quality strategy, or a separate patient safety plan can be put in place. And just outline is given here. It should have a purpose, it should have a mission, vision, and values, and commitment. And there should be strategic goals and objectives in place. It should have the scope of to which patient safety practices this plan is going to apply to, or to be applicable to. Then it should list the responsibilities, whether it's the team, whether it's the leadership, for the different teams, for the board of directors. There can be different departments and the different communities and stakeholders. And the different stakeholders in the community, they can be volunteers or members or patients or caregivers, anyone. The responsibilities can be listed there. Then the important processes should be listed in the plan, whether these are identification of patient safety issues, or whether this is patient safety education. It should have the confidentiality of how the document is going to be kept confidential, how to whom the access is going to be given to, who can edit it, who can review it, and who can access it. Ultimately, it should have a program evaluation, which can be required annually or as earlier as required. It can be quarterly or biannually. You can get further details regarding the patient safety topics from these references, which are given at the end, so that you can get more details about each and every topic and each and every terminology that is being used in this presentation that I have not used here as well. So that ends my presentation here. Thank you.
Thank you so much, Dr. Aqsa. It was really kind of you. Really, we appreciate your time and effort, and especially it's very kind of you that you had made room for joining this session as a speaker. Everyone, if you have any question, please if you have any question, can you write in the chat box so we can ask the speaker? because otherwise we will be closing the session. I will just wait for like 2 minutes. If anyone have any question, please write in the chat box so I can ask the speaker. Thank you everyone for appreciating. I think this session is only successful because of we have regular audience. Some people are regular, mashallah. So I think the sessions are only successful because of them. So thank you everyone for listening us. And please, I have one request. Please, if you can just give us feedback regarding the session, regarding the whole course or the speaker, or what you want us to improve, or what you want us to focus on, or what you are not understanding, please let us know. So in the next cohort, we will try to improve those points. So really, your feedback is really important to us. So if you will just write one sentence or two sentences, so it will be very kind of you. So I think we don't have any question. It's already 2 minutes up. So I will be closing the session. Thank you, everyone. Thank you for joining the session. And good evening. Allah Hafiz.
Allah Hafiz. Thank you for having me.
Always welcome.